day that the Lord has made. We will rejoice and be glad in it. So today I'm going to be talking to you on ulcerative colitis. Now, I know this may be something new for a lot of people to hear about. You may not have heard this before, but it is prominent. And so I wanted to touch base on that a little bit today. So as my laptop loads. So what is ulcerative colitis? Ulcerative colitis is a chronic disease of the large intestine in which the lining of the colon becomes inflamed and develop tiny open sores or what's called ulcers. This condition is a result of your immune system's overactive response. Now, if you look to the left of my screen, you may see a picture of what a normal colon looks like. And in the middle, it shows you what an ulcerative colitis colon looks like. So it's very inflamed. So what are the signs and symptoms of this disease? The symptoms of ulcerative colitis vary from person to person, and about half of all ulcerative colitis patients experience mild symptoms. Just keep that in mind. So some of the symptoms include diarrhea, often with blood or pus, rectal bleeding, passing small amounts of blood in your stool, abdominal pain and cramping, rectal pain, urgency to defecate, inability to defecate despite this urgency, weight loss, fatigue, fever, and in children, failure to grow. So what are the types? So there are different types. Healthcare providers often classify ulcerative colitis according to its location. The symptoms of each type often overlap. So types of ulcerative colitis include ulcerative proctitis. In this, inflammation is confined to the area closest to the anus, which is your rectum, also called your rectum as stated. Rectal bleeding may be the only sign of this disease. Then you have proctosigmoiditis. Inflammation involves the rectum and sigmoid colon, the lower end of your colon. Symptoms include blood diarrhea, abdominal cramps and pain, and inability to move the bowels despite the urge to do so. Then you have left-sided colitis. This inflammation extends from the rectum up to the sigmoid and descending portions of the colon. Symptoms include bloody diarrhea, abdominal cramping, and pain in the left side and urgency to defecate. Then you have pancolitis. This type often affects the entire colon and causes bouts of bloody diarrhea that may be severe, abdominal cramps and pain, fatigue, and significant weight loss. Let's talk about the risk factors. Ulcerative colitis affects about the same number of women and men. Risk factors, however, may include age. Ulcerative colitis usually begins at the ages around 15 to age 30, but it can occur at any age. Some people may develop the disease until or after age 60. Race or ethnicity. Although white people have the highest risk of the disease, it can occur in any race. If you're of Jewish descent, you are at a higher risk. Family history. You're at a higher risk if you have a close relative, such as a parent, a sibling, or a child with this disease, and like a lot of illnesses also. If you use frequent non-steroidal anti-inflammatory drugs, like there's a lot of people that abuse ibuprofen, Advil, Motrin, that puts you at a high risk. And eating food that is high in fat. So what are the treatments? The primary goal in treating ulcerative colitis is to help the patients regulate their immune system and making it better. While there's no known cure for ulcerative colitis and flare-ups may occur, a combination of treatment options can help you stay in control of your disease and lead to a full and rewarding life. Treatment of ulcerative colitis is multifaceted and includes the use of medications, clinical trials, alterations in your diet and nutrition, sometimes surgical procedures to repair or remove affected portions of the GI tract. If you're confused about the medications and therapies out there, remember you're not alone. The disease is extremely complex, and it's important to review the risks and benefits of all treatment options with your provider. So let's talk about food, because a lot of us like to eat. I'm a foodie too, I like food. So foods to eat during an ulcerative colitis flare. If you have ulcerative colitis, you may already know the food that worsens your flares. Diet can help manage ulcerative colitis by putting less stress on the colon. This typically involves what's called a low residue diet, comprised of foods that doesn't leave undigested grit in stools. By eating low residue foods, there's less chance that stools will scrape against open sores in the colon and cause pain and bleeding. Then there's what's called the brat diet, composed of bread, white rice, applesauce, and toast. Applesauce is soft and so it's easily digestible. So be sure that if you're going to have that, you choose unsweetened variety though, because added sugar can cause more inflammation. Ripe bananas, canned fruits, soft-cooked vegetables, and probiotics. If you're not lactose intolerant, yogurt can provide you with some protein and probiotics, which are live bacteria that may help the digestive system. Foods to eat again, nut butter. Examples are like peanut butter, almond butter, cashew butter, and other nut butters are another source of protein and healthy fats. So you want to make sure that when you choose these, however, you choose the ones that's creamy, not the ones that have the nuts. White rice with turmeric. If you can't tolerate most foods during an ulcerative colitis flare, you may want to stick with bland choices such as cooked white rice. If you want to add flavor, try and sprinkle in some turmeric, which is a yellow spice whose key ingredients, curcumin, has shown some benefits in the treatment of ulcerative colitis. Water, sports drinks, and fruit juices. Yes, some people may have to have this. And the reason why, the diarrhea often occurs during ulcerative colitis, causes the person to lose a lot of fluid. And so you want to replenish them. And that is important and key. Salmon. Salmon has healthy omega-3 fatty acids that may help reduce inflammation. If you don't like salmon, you can try tuna, shrimp, or other fish that are high in omega-3 fatty acids as well. Foods that you want to avoid and things you want to avoid: alcohol, cakes, muffins, brownies, candies, chocolates, all those good stuff we like to cheat on every now and then. Coffee and other caffeinated beverages, dairy if you're lactose intolerant, dried beans, legumes, fast food, fried foods, fatty cut meats, grassy, cruciferous vegetables like cabbage, broccoli, cauliflower, nuts and seeds, processed meats like bacon and sausage, raw fruits with seeds or skins like berries and unpeeled apples, raw vegetables, sodas, other carbonated beverages, sugary drinks, including high sugar fruit juice, spicy foods like curries and chili. Us Jamaicans, we love that spice. Whole grains like brown rice, quinoa, and white rice. Whole grain products like whole grain bread, pasta, and cereal. I want to give special acknowledgement to Mount Sinai, the Cleveland Clinic, NIH, and Chronic Colitis Foundation with the information that I've provided with you today. I hope this was helpful. If you have any questions, please feel free to join us in the Zoom room. I'll be happy to answer them for you. God bless you. Thank you for your time and enjoy the rest of the service.